Professor Morita, thank you very much for sharing your time with us today. And Professor, could you tell us about the West Nile virus? We've been hearing about the virus for some time now, and what kind of disease is it?
Well, the West Nile virus is a member of the flag viruses, which include the famous yellow fever and dengue viruses. The West Nile virus is transmitted by mosquitoes and is widely distributed in Africa, Middle East, and East Asia, including the Indian subcontinent. As you know, the West Nile virus has recently reached the United States in 1999, when it emerged in New York State for the first time, and now seems to have become established in the American continent. The virus moves from mosquito to bird, and bird to mosquito. And this infection cycle is essential for survival of the virus in nature. And mosquitoes carrying the virus also can transmit the virus to humans. This is the principal mode of transmission of the virus to humans. The West Nile virus infection shows a variety of symptoms in humans. However, in general, many infected persons show no overt symptoms. The symptoms most commonly seen are fever, headache, muscle pain, general fatigue. And these are common symptoms in most acute virus infections. So there is no unique symptom or sign for West Nile virus infection, while the meningitis and encephalitis sometimes occur mainly among elderly people and can be lethal. However, the West Nile virus strains entered in the United States seems to be more virulent than those in the original West Nile virus epidemic area, such as Africa. For example, in Africa, the virus usually does not kill birds, while the West Nile virus in the United States has already killed many birds. Also, proportion of the patients with neurological symptoms seem to be higher than so-called Old World West Nile virus infections. This is one reason for our serious concern about the West Nile virus epidemics in the U.S.
And how many people have been infected with the virus so far?
Actually, the number of the patients is not known at the global level. But in highly endemic areas such as Middle East, about 60% of the population have been infected in some areas. Therefore, we think quite a large proportion of population are infected in tropical and subtropical areas. In the United States, this year alone, more than 3,000 infections have already been reported, with more than 170 deaths. And considering the fact that the West Nile virus is amplified between ordinary birds, such as crows and ubiquitous mosquitoes breeding in cities like New York and Tokyo, I believe that this virus surely poses a serious global public health threat.
And this is very scary, but what sorts of measures have been taken to prevent the disease?
As I mentioned, this virus spread to New York City in 1999 for the first time. And that year, the virus activity was recognized in only 4 states around the New York State. But it has since spread very, very quickly. This year, the virus already reached to the West Coast, California, and more than 30 other states reported virus activities. So this speed is much higher than was expected. 3 possible ways for the rapid dissemination of this virus are conceivable. Infected humans and mosquitoes could be carried by rapid transportation like aircraft. And the migration of birds carrying the virus could also be responsible. And also, a number of birds are moving in long distance by international and domestic trade. So, because these factors exist between Japan and the U.S., it is of great concern that the virus would be carried to Japan in the near future. So, in Japan, the relevant ministries have already strengthened their mosquito surveillance and control activities at international airports such as Narita and Kansai Airport. and began active surveillance of urban birds, particularly crows. Fortunately, so far there is no evidence that the virus has entered Japan.
But in our daily lives, what can we do to protect ourselves from the disease? I mean, mosquitoes there are plenty of mosquitoes, and they're so tiny.
Presently, the West Nile virus vaccine for humans is not available. Therefore, mosquito control is the only conceivable means for prevention to prevent infection. So, at the personal level, for example, when you go outside in summertime in virus circulating areas, use of repellent and wearing long-sleeved clothes and trousers are recommended. Also, at nighttime, when you go to bed, the use of mosquito coils is considered to be effective. But of course, the first thing is to get updated, accurate information on the West Nile virus epidemic situation. If there is no virus activity there, you do not worry about the virus. So the CDC of the United States and the厚生労働省, the Ministry of Health, Welfare and Labor of Japan, providing those data to the public through internet.
And what should be done if one thinks he or she may have been infected with the virus and they start worrying about it?
This virus does not cause chronic infection like HIV and other hepatitis viruses. This means that even if you contract the disease, the virus would disappear within 5 to 7 days of infection. However, supportive medical care is important in severe case, like meningitis and encephalitis. In this case, early consultation of physician is recommended. But I should stress that in most cases, symptoms will disappear on their own.
And who are most vulnerable against this disease? Elderly people, children, or the young people?
Yes, as I said, that in many symptoms are expected very mild. But elderly people sometimes develop this central nervous system infections. So they should be aware of this fact and should be careful.
I see. And Professor, earlier you told me that this virus will be infected through mosquitoes and then birds and then go back to mosquitoes. And I'm kind of concerned about, animals staying outside. I mean, like dogs, cats, and other cattle. And do you worry about those animals too? Well,
it is observed in many countries and also in the U.S. that a horse also can be infected with this virus. And the characteristics of this West Nile virus is that it has a very wide range of hosts and vectors. So there's no report that the dogs developed encephalitis, but I think there is a possibility that it could be infected.
I see. Well, sounds very scary. And Professor, what kinds of treatments are available right now to cure the disease?
There is no specific treatment at the moment, such as antiviral drugs. At the moment, antiviral drugs are available only for HIV, herpes, or influenza, and some other viruses. Therefore, again, supportive treatment is the only medical care we can offer.
So you mean that it would take a long time to develop medicines to cure the disease?
Exactly. The development of antiviral drugs needs a long time. Also, of course, this is not a job for a single vaccine company, but requires a national initiative to start the development of a new West Nile vaccine. So I do hope this will be the case. However, for the most effective prevention measure, vaccination, I think we have some advantage and reason for hope. Actually, in Japan, we have another mosquito-borne viral disease, which is very similar to the West Nile virus infection. That is Japanese encephalitis. And during 1960s, this disease was responsible for thousands of encephalitis patients and hundreds of deaths annually. However, after the development of an inactivated Japanese encephalitis vaccine, followed by implementation of a nationwide immunization program, the number of cases quickly declined, and these days we have only less than 10 cases annually. And West Nile virus and the Japanese encephalitis virus belong to the same group, the flaviviruses, and their structures and antigenicity and other biological characteristics are very similar. So it is therefore expected that the West Nile virus vaccine can be developed quickly or quite easily using the technology and know-how we accumulated during the development of the Japanese encephalitis vaccines in the last 4 decades.
I hope that, we will come up with a very good treatment and vaccination. Mm-hmm. And Professor Morita, thank you very much for sharing your time with us today.
You're welcome.
That was Professor Koichi Morita of the Institute of Tropical Medicine, Nagasaki University, interviewed by Kaori Nimura.